I'm actually very moved to introduce you to these videos. It is husband and wife, John and Cindy Cooper. Cindy was a 7-year pancreatic cancer survivor who passed away only a short time ago. With her husband John's support, we'd like to share and honor her story with a video that he's given us permission to use and to play today. I think you'll come to the same conclusion that I did, that Cindy was clearly a force of nature, someone who made every moment count. Her husband, Dr. John Cooper, who is an anesthesiologist in Ottawa, had also intended to be with us today, but himself experienced a recent health issue and challenge. However, he wanted to be part of the conference and has recorded a video for us as well. In sharing both of these videos, I personally can't think of any better way to express the deep purpose behind the work that colorectal cancer and the team does, and the continued high need to work together for change. I hope we come to the same conclusion.
I live in Ottawa. I'm a mom of 2 boys, an avid triathlete, and married to John, an anesthetist and critical care doc at the Ottawa Hospital. I was diagnosed with pancreatic cancer in January 2013. We were terrified. The 5-year survival rate is only 10%, and we couldn't find anyone, real or through the internet, that had survived this cancer beyond 2 years. My first year after diagnosis was filled with a 10-hour surgery called Whipple's, 18 rounds of chemotherapy, 28 days of radiation, and much hope that I'd survive the year. I also completed Ironman Canada between rounds of chemotherapy. A 4-kilometer swim, 180-kilometer bike, and then a marathon. It took 16 hours and 38 minutes, raised a lot of media attention, and $50,000 for cancer research. This was the beginning of my fundraising efforts. As I approached 2 years survival, shocked but extremely grateful that I'd made it, I felt a strong desire to give back. I remembered what it felt like to not be able to find anyone who had survived this cancer beyond 2 years. I became more active on social media to get my story out there. Now it feels incredible to be in contact with hundreds of people all over the world to whom I've given hope that they too can beat the odds. I pulled together my family and friends to form a team to walk or run at Ottawa Race Weekend and raise money for cancer research at the Ottawa Hospital. Our team name is MEMC Crew, Make Every Moment Count. We have just reached the incredible milestone of raising $500,000. Unfortunately, a year ago, my cancer metastasized to my left lung, 1 rib, and my T5 spine, and I became stage 4 palliative. My cancer was being controlled with chemotherapy, but 4 months ago, it started to spread in my left lung, and I was given a new prognosis of only 6 months to live. My oncologist suggested it was time to start looking at clinical trials. We were game to try anything. Thankfully, I'd had molecular testing done a couple of years ago. It cost $2,500 for me, but it revealed that I had a KRAS gene mutation. My oncologist felt a trial targeting this mutation would be my best option. She gave us the name of 3 trials, the bad news that none of them were in Canada, and John and I began our search. We researched which cancers in the United States were holding the trials and which trial was having the best results. We sent my medical history and reports, a painstaking process, to 8 cancer centers in the States. We traveled to 2 centers to meet the principal investigators, hoping that might increase my chances of getting into a trial. I went to social media with my plea to try to get into a trial. Years of sharing my story of hope for others now returned good karma, and after 6 weeks of hard work, I was able to get into my trial of choice at Next Oncology in Fairfax, Virginia. This process of starting on a trial would have been so much easier if one had been available in Canada. I started the trial on January 4th. In the 8 weeks since, I've spent 7 days at the Fairfax Clinic, 6 trips back and forth, a 9-hour drive each way or a flight back and forth to Washington, D.C. Lots of traveling, it's extremely exhausting, and the cost so far is $15,000. Taking part on a clinical trial would have been so much easier if one was available in Canada. I don't know why there aren't any CRAS trials targeting pancreatic cancer stage 4 in Canada. I do know that this trial is offering me hope, as well as 30 others at the clinic, and has made me feel better than I did in December and January. I have a CT scan in 3 days to hopefully find out that my cancer is stable, or maybe even getting smaller, and giving me a chance to live several more months in this beautiful life. Thank you for listening.
Good afternoon. My name is Jonathan Hooper, and I'm very glad to be part of this conference. I have to apologize for not being there in person. Unfortunately, life threw a bit of a medical curveball at me in the last few days, hence this very hastily made and definitely amateur type video, but I hope it suffices. I would like to thank the organizers for inviting Cindy and I to this conference to share her patient experiences. I must say that as a physician, I am very embarrassed to say that I wish I had learned much earlier in my career how different a patient experience is than from the physicians and from the nurses. So in many ways, I'm glad to be representing Cindy here today. I presume you just saw Cindy's video, which was made earlier this year, probably a couple of months into her clinical trial in the United States. Initially, the results looked promising from a clinical point of view, but unfortunately in July her cancer came back, and sadly Cindy passed away in September. I'll try to represent Cindy's views of her trial in the United States. There are also the views of several other Canadians that we met who were having clinical trials down in the United States. We obviously can't speak on clinical trials in Canada, other than perhaps stress the point how valuable your work is into trying to get more trials into Canada, because it is not easy to do a trial in one country. A couple of disclaimers before I start. Cindy and I would both tell you that we feel like we were incredibly lucky and had many advantages over the average patient coming for a clinical trial in the United States. Cindy had a background in health administration, and I've been a critical care anesthesia physician for many years, and it certainly makes it easier to navigate complex medical systems even if they're not in your own country. We also had an unbelievably phenomenal oncologist, Dr. Rachel Goodwin, who went above and beyond to help us out, and we had help from several medical friends, especially Dr. Rebecca Auer, who I believe is at the conference today, who was phenomenal in helping us navigate the trials. We also were both at a point in our lives where financially we could afford to spend a fair amount of money on a clinical trial. I think Cindy mentioned in her video that at that point we had spent $15,000. I would think probably by the end of it, we're probably around $50,000 for 6 months, which a lot of other people could not afford. Cindy and I would both agree one of the biggest problems was learning how to navigate the entire system. In her video, she mentions how it was a painstaking process, and that was an understatement. When looking for a trial in the United States, one has to decide whether you are looking for a specific trial or if you're looking for a specific center. Certain centers have the trial you want, others don't. And there may be many centers with that trial, or there may be just an isolated few. Some of them may be geographically close, some of them may be very far. Some centers were easy to communicate with. They responded very quickly. Others were very hard to communicate with. They would not respond or would respond very slowly despite numerous phone calls and emails. One of the first centers that we approached, a very large, well-known cancer center, wanted $14,000 up front just to look at Cindy's medical records. Fortunately, we knew enough that that wasn't necessary to spend $14,000 up front, so we graciously declined and moved on to other centers. The application process was similar for most centers, sending a lot of your medical information down. Initially, we had troubles with some of the hospitals in our own city who said it would take 3 weeks to get that information together. Fortunately, again, we knew better than that and were able to change it to 3 or 4 hours instead of 3 or 4 weeks. Even if a medical center accepts you to go into a certain trial, there's no guarantee that you'll get into that trial. Spots are allocated intermittently and in various different numbers. And there were several centers that we spoke to that did not think that particular trial we would want to get into would be available for up to 6 months. So we applied to a number of centers and felt like we were playing the lottery. One of the conditions with this particular trial, which is not uncommon, is that you have to stop your regular chemotherapy 4 weeks before entering the trial. So there's a big leap of faith there, stopping it and hoping you are going to get into a trial sometime in the next 4 weeks, which it could easily be months. The bottom line is you have to be very persistent. Cindy is very good at that, and to be very, very organized. We were told by numerous centers they thought it would be highly unlikely that spots would open up for us in any reasonable timeline. And we were offered other trials with drugs that we knew absolutely nothing about. We were quite shocked, surprised, happy that within a few days of being told that, more spots opened up and we were able to get into the trial. One of the obvious concerns about doing a trial in the United States is cost. Fortunately, with most trials, the sponsor covers a lot of the costs, but not necessarily all. And there were some big surprises along the way. One day, Cindy had significant trouble with nausea and vomiting, and they gave a, quote, special antiemetic, which 3 months later we had a bill for $1,200 for that. There were several other things that the local institution felt were outside the realm of the trial, and they had bills for us for those things as well. We had lots of discussions with their finance department about it. Awkward spot to be 2-3 months into a trial which seems to be working, and you don't want to, be frank, you don't want to piss them off and get yourself out of the trial. So a lot of negotiation went on. Some we won, some we lost. You learn a lot of things about American healthcare system when you're there. We were handed a prescription one day for what the preferred antiemetic would be for Cindy, and we went off to the local drugstore to get it, and it was going to be $1,447 for a 1-month supply. Didn't know what to do, so we said we'd come back the next day, and when we went back to the clinic, we asked them about this, and they looked at us as though we were very stupid and said, nobody ever pays that. You just go online, go to this website, they price match across the US, and they'll download a coupon which you'll take in, and it'll be much cheaper. So we did that, and instead it was $44 for the next month. But if you don't know this and don't know how to navigate through the system, it could be a nasty financial surprise. One of our biggest worries about going down to the States was that having cancer, Cindy could not get health insurance with anybody. And if anything happens to her that was outside of the trial, then we would be totally financially responsible for it. She indeed one night had a bout of biliary sepsis, which happens with people who have had ripples before. She got pretty sick. Her temp went up to over 39 degrees, and she had literally bed-shaking rigors. Fortunately, Cindy had that before when in Canada, and we were able to pick up on the symptoms really quickly and had her on broad-spectrum antibiotics when her temp was still 37.5. And it was a tough night, and I was actually saying we should go into the emergency department, but Cindy declined, and we fortunately, everything went well, and we got through it. I think a lot of other people with a medical background and not carrying all the silly medical equipment that I carried with me would have fared so well and would have probably been in an emergency department, and easily could have been a very large price tag. We did meet a Canadian couple who had been in a trial, and they eventually quit because they could not afford it. A couple of times they ended up in an emergency department and paying $30,000, $40,000 a go. Obviously, traveling to the US involves travel. Travel can be expensive, and it can also be extremely tiring for patients who are already deconditioned and taking all sorts of different medications. Cindy and I were lucky. We live in a major city close to an airport and have the financial means to fly or drive. A lot of other people don't have those financial means. It also means the patient or their partner taking time off work and less income for traveling to faraway distances. There are a lot of great organizations out there that will help patients that are traveling with all sorts of things, be it food vouchers or gas or accommodations, or sometimes even with airfare. Trying to figure out who these organizations are and how to contact them and who they will do stuff for and who they won't is really incredibly complex. I think you have to be some kind of ninja savant to figure this all out. Short of being a ninja savant, there's always Facebook, and there's all sorts of chat groups out there which all sorts of information is exchanged. But like most other social media platforms, some of it's great and some of it's kind of dodgy at best. I'm going to finish off by reiterating that Cindy and I both felt we were incredibly lucky. Lucky getting into the trial. Lucky that we had so many advantages that other people don't have to negotiate very complex systems and trying to negotiate them when you don't feel well. We met numerous other people that couldn't get into a trial or didn't have the financial ability to get into a trial, or were just too tired and fatigued once they were in a trial and couldn't carry on. So I'd like to thank you for the work that you're doing, and make a plea to carry on and keep on trying. I'm sure at times it seems like an incredible ordeal, and probably feels like finishing an Ironman. So I will leave you with a picture of Cindy finishing Ironman Canada in 2013. Thank you.